Long-distance travel by train, bus or plane is a risk factor for thrombosis. Particularly deep vein thrombosis or DVT, which can lead to a pulmonary embolism if a clot travels to the lungs. Deep vein thrombosis is a blood clot that forms in a deep vein, usually in the leg. It is a serious condition that can be life-threatening. I am also going to talk about how to prevent it. DVT can occur during or shortly after travel, but it can also take several weeks to develop. This is often called economy class syndrome, though it can happen in any seating class. Why does flying increase thrombosis risk? Prolonged immobility. Sitting for long periods, especially greater than 4 hours, slows blood circulation, increasing clot risk. Dehydration. The low humidity in airplane cabins can lead to dehydration, which thickens the blood. Low cabin pressure and hypoxia. Slightly lower oxygen levels at high altitudes may contribute to blood clot formation. Compression of leg veins. Sitting with bent knees restricts blood flow in the legs. Who is at higher risk? People with history of DVT or pulmonary embolism. Recent surgery or injury, especially in the legs. Pregnancy or postpartum period. Obesity. Cancer or chemotherapy. Smoking. Birth control pills or hormone therapy. Genetic clotting disorders. While the risk of developing blood clots during travel is real, especially on long journeys, it's important to remember two key things. For most healthy individuals, the chance of getting a blood clot while traveling is very small. Simple preventive measures can significantly reduce your risk. By being proactive and taking some precautions, you can enjoy your trip with peace of mind. What are blood clots and why are they a concern during travel? Blood clots are clumps of blood that form inside a vein, typically in the deep veins of the legs. During travel, prolonged sitting and cramped conditions can slow blood flow, creating an environment conducive to clot formation. This condition, called deep vein thrombosis or DVT, can be uncomfortable and cause swelling and pain in the affected leg. In a more serious scenario, a piece of the clot can break loose and travel to the lungs, blocking an artery and causing a potentially life-threatening condition called pulmonary embolism. Who is at increased risk? While anyone can develop a blood clot while traveling, certain factors elevate the risk. Number 1, medical conditions. Existing medical conditions like cancer, heart disease, and inflammatory bowel disease can increase your risk. Number 2, recent surgery. Having had recent surgery, especially abdominal or orthopedic surgery, puts you at higher risk. Number 3, family history. Having a family history of blood clots can be a risk factor. Number 4, personal habits. Smoking, being overweight or obese, and taking certain medications like birth control pills or hormone replacement therapy can also increase your risk. Preventing blood clots while traveling. The good news is that there are plenty of things you can do to minimize your risk. Move around. Get up and walk around every 2-3 hours, even if it's just a short stroll up and down the aisle. Stay hydrated. Drink plenty of water throughout your journey to keep your blood thin. Avoid alcohol and caffeine. Stretch and flex. Do simple leg exercises like ankle circles and calf raises while seated. Wear compression stockings. You can buy them from most pharmacies or drug stores. 4. These specially designed stockings can help improve blood flow in your legs. Number 5. Talk to your doctor. If you have any concerns or risk factors, consult your doctor before traveling. They may recommend additional preventive measures, such as taking blood-thinning medication. Additional tips. Number 6. Choose an aisle seat when possible to give yourself more room to move around. Number 7. Avoid crossing your legs while sitting for prolonged periods. Number 8. Wear loose-fitting clothing. Number 9. Avoid alcohol and caffeine in excess, as they can dehydrate you. Number 10. Avoid crossing legs, reduces vein compression. Number 11. Consider low-dose aspirin or blood thinners. Talk to your doctor before travel. Consider vaccination if traveling to an unfamiliar country. Recognizing the signs of a blood clot. While rare, it's important to be aware of the symptoms of DVT and PE. Leg pain or swelling. especially in the calf or thigh, redness or warmth in the affected leg, sudden shortness of breath, chest pain, coughing up blood. If you experience any of these symptoms while traveling, seek medical attention immediately. Traveling can expose individuals to various health risks, depending on the destination, mode of transportation, and individual health conditions. Here are some common health risks associated with travel. Some quick tips. Number 1. Always take your medication and prescriptions. Number 2. If you are likely to encounter hypo situations, carry some suitable food to eat if you feel hungry. Number 3. Always take your blood sugar testing meter. Number 4. It may be hard to find suitable diabetic foods on a plane in the country you visit. So be prepared for that. Infectious diseases. Airborne diseases. Traveling in crowded places, such as airports and public transportation, can increase the risk of exposure to airborne infections like influenza or respiratory viruses. Vector-borne diseases. Some destinations may have a higher prevalence of diseases transmitted by insects, such as malaria, dengue fever, or Zika virus. Food and waterborne illnesses. Consuming contaminated food or water can lead to diseases like traveler's diarrhea, gastroenteritis, or food poisoning. Altitude sickness. Traveling to high-altitude destinations without proper acclimatization can lead to altitude sickness, characterized by symptoms like headaches, nausea, and fatigue. Jet lag. Rapid travel across multiple time zones can disrupt the body's internal clock, leading to symptoms like fatigue, insomnia, and difficulty concentrating. Injuries. Accidents and injuries can occur during various activities, such as hiking, water sports, or even transportation-related incidents. Environmental hazards. Exposure to extreme weather conditions, such as excessive heat or cold, can pose health risks. Sunburn, heat stroke, and hypothermia are potential concerns. Vaccine-preventable diseases. Some destinations may require specific vaccinations or have a higher risk of diseases like hepatitis, typhoid, or yellow fever. Sexually transmitted infections, STIs. Engaging in sexual activities in unfamiliar environments may increase the risk of contracting sexually transmitted infections. Stress and mental health. Travel-related stress, anxiety, and disruptions to routine can impact mental health. Additionally, cultural differences and language barriers may contribute to stress. Local health infrastructure. Access to healthcare services may vary widely in different locations. In some remote areas, medical facilities may be limited. To mitigate these risks, travelers should take preventive measures such as getting appropriate vaccinations, practicing good hygiene, staying hydrated, and being cautious with food and water consumption. It's advisable to research health risks specific to the destination and consult with healthcare professionals before traveling. By being informed and taking some simple precautions, you can significantly reduce your risk of developing blood clots while traveling. So, pack your bags, embrace the wanderlust, and enjoy your journey with the knowledge that you've taken steps to prioritize your health and well-being. I hope this 10-minute read has equipped you with the knowledge and confidence to navigate your travels without letting blood clot concerns cast a shadow on your adventure. Remember, preparation is key, and with a little awareness and some proactive measures, you can ensure a safe and enjoyable journey. Now go forth and explore the world. Please note, this information is for educational purposes only and should not be construed as medical advice. Always consult your doctor before traveling, especially if you have any concerns about your health. Do not forget to click the like button. Thanks very much for watching this video. Up above you see a video related to health. It will be more helpful to you and your family. Subscribe to my channel. See you in the next video.